cancer showing extraordinary results, quote, extraordinary results in the first clinical trials. Scientists are saying now that it could be a breakthrough in curing cancer. Joining us now for more on this from Raleigh, North Carolina, is recognized cardiologist and medical expert, Dr. Campbell. Dr. Campbell, good to see you. Thank you so much for joining us.
Thanks so much for having me.
So characterize what we're seeing here. This is amazing news.
It really is. It's called immunotherapy, and the basis of this therapy is we use our own body's immune system to fight cancer cells, and it's done in a way that, is very, very successful. It's early, and we've got a lot more work to do, but this is very promising.
So promising in what kinds of cancer specifically? What are we talking about in terms of where we're actually seeing major improvement and closer to a cure?
So the two cancers that were studied are something called non-Hodgkin's lymphoma and another one that is a particular type of leukemia, which are sometimes very deadly cancers. And in this case, we took the patient's own white blood cells, took them out of the body, tagged them with a protein that helped them fight the tumor cells with their own immune system and put them back into the body. And the success rates were anywhere from 70 to 90%. However, these were very small clinical trials.
Wow, this is important, Dagan, because these are two cancers that actually are among the hardest cancers to get our arms around. And now we're talking about getting closer to a cure.
Absolutely. Doctor, how does this treatment differ than some of the immunotherapy drugs that are already on the market, and even their application is being expanded, it's starting with many, like your metastatic melanoma, but then they've been approved for lung cancer treatment, for example?
So what you're seeing here is what we're calling personalized medicine, where we base your treatment on your own genetic code, your DNA. So we're taking your cells out of your body and then putting them back in and allowing them to kind of turn on your own immune system. So it's very targeted, it's very personalized. I still think we're years out from mainstreaming this, but this was really promising, because in cancer, you rarely see success rates like 90% for cure in some of these more lethal diseases.
I was going to ask you about the cost differential between a drug that's been approved and a personalized immunotherapy treatment like this. Is there any way to know how much the price disparity would be?
If we base it on what we're seeing with all the new drugs, for instance, for hepatitis C, that is $80,000 for a treatment for 3 months, I expect these are going to be incredibly expensive, and I think that's because of all the R&D that goes into it. So my hope is that we figure out a way to do this, mainstream it, and then make it affordable for all Americans so that everyone can get the health care they deserve.
What are we still waiting for in terms of the barriers? Where is the hardest fought cancers right now? And are we seeing this kind of progress because, not obviously the investing in R&D, but after the human genome, and we've got so much data that has certainly made us smarter about this?
I think certainly, sequencing the human genome has made a huge difference in our ability to treat these diseases. I do think that, over time, we're going to be able to develop more and more therapies. But I think that, immunotherapy is so new. We have to remember these trials were 7 patients and 9 patients. The biggest barrier is side effects, because when you turn the immune system on against cancer, it releases all these chemicals in the body that can make you incredibly sick. So we're still fighting the side effect battle with these treatments.
Oh, I see. Okay. Dr. Campbell, thanks so much for your insights. We appreciate it.
Thanks for having me.
Bringing us a bit of